So once again, this is Krok 1 2015 booklet, the first presentation or the first video of 7, I think. All right. So let us begin right away. So we have a characteristic sign of glycogenosis. Characteristic sign of glycogenosis is muscle pain during physical work. That means there is pain as a result of what? Physical activity or physical work. Blood examination usually reveals hypoglycemia. Hypoglycemia. Now, this pathology is caused by a congenital deficiency of the following enzyme. So now they've told you that this person is suffering from what we call what? A glycogenosis. Now, the word glycogenosis also means glycogen storage disease. Glycogen storage disease. And what are these? These are simply metabolic disorders that are caused by enzyme deficiencies. They are caused by enzyme deficiencies, either in glycogen synthesis. Now, when we say glycogen is the storage form of glucose. So don't get confused. Glycogen is simply the storage form of glucose. And we know that it is when glucose is broken down that you and I can get energy. So in case glucose is not broken down, it means that energy cannot be produced. And when energy is not produced, what happens? You can get tired easily and things like that. Now we are saying that glycogenosis or glycogen storage diseases is when there is a problem either with glycogen synthesis, that is how it is stored, or glycogen breakdown. Now, when we say glycogen breakdown, if you have stored something, it is saved. Now, you want to break it down because you demand it, or you need it to be used, or you need what is inside to be used. So you want to break it down so you can release the glucose for your usage. So anytime there is enzyme deficiencies that are affecting these processes, the term is called glycogenosis. Now, we have done this thing before, but for the sake of people who have just joined, that's why I'm taking my time to go over them again. So these things can usually happen within the muscles and or within the liver cells. Now, there are a lot of types of glycogen storage diseases or glycogenosis. There are a lot of types. Now, this particular one is called type 5. This is type 5 glycogen diseases. Type 5. And this is caused by a deficiency of glycogen phosphorylase. Glycogen phosphorylase. It is caused by the deficiency of glycogen phosphorylase. This is type 5. So in the case whereby there is muscle pain during physical activity, and as a result, there's hypoglycemia. That means there is low amount of glucose inside the blood. Low amount of glucose inside the blood. What it means is that when the glucose was stored, the enzyme that helps with the release of the glucose is impaired. And that enzyme is called glycogen phosphorylase. Glycogen phosphorylase. So please, as an assignment, go and look for the other types of glycogen storage diseases or glycogenosis. So over here, your answer should be what? Glycogen phosphorylase. This is called type 5. This is type 5. Type 5. Okay. Now, histologic specimen of a kidney demonstrates cells that are closely adjoined to the renal corpuscles in the distal convoluted tubule. Their basement membrane is extremely thin and has no folds. These cells, guys, look at it. This is your clue. These cells sense the changes in sodium content of the urine and influence renin secretion. So it helps in the detection of what? Of sodium It helps in the detection of sodium. So the question now is, what substance or what structure is responsible for sensing sodium concentration in the urine? And your answer is simply what? Macula densa. Macula densa. Macula densa is simply an area of closely packed specialized cells that are very, very sensitive to the concentration of sodium chloride in the distal convoluted tubule. So anytime there is decrease in sodium chloride concentration, the cells would decrease the resistance to blood flow in the afferent arterioles. Now, when I talk about afferent arterioles, you should know what all of these things are. I don't want to go into deep about all of these things, but basically, we have these kind of, let me say, vessels, okay? And or let's say they drain into something like this or into a pouch. Should I say a pouch? Yes, into a pouch. That's the nephron, okay? Or the glomeruli. The glomeruli, okay. Now, blood can come here, okay, and blood can leave over here. So these one, we call them what? The afferent and the efferent. Efferent means away. Afferent means towards the nephron. And efferent means away. Okay, I don't want to go into deep with all of these things. But basically, the macula densa has to do with what? Sensing of sodium chloride concentration. Sodium chloride concentration. However, inside the juxtaglomerular cells, a substance called renin is being secreted. And this renin will lead to vasoconstriction. It leads to what? Vasoconstriction. Okay. So renin is released from the juxtaglomerular apparatus or cells. So please take note of some of these differences. Macula densa, juxtaglomerular cells, and so on. Podocytes are simply finger-like structures. But for now, we don't need to go much into details. So over here, we're looking at what? At macula densa. Macula densa. A 46-year-old female patient has continuous history of progressive muscular dystrophy. Now, when we say progressive muscular dystrophy, it means the muscles are undergoing degeneration or they are being destroyed. Muscle cells are being what? Destroyed. And one of the features that helps us to know that muscle cells are being destroyed or they are undergoing degeneration is the presence of what we call creatinine phosphokinase. Creatinine phosphokinase, also known as CPK or CK. So they are all sort of what? Enzymes. It's like a biomarker. Now, when we say marker, what helps you to know that there's an infection, for example, is when there's too much WBC, isn't it? That's a marker that there is some sort of what? Bacteria infection. When lymphocytes are high, you know there's a problem with what? With viral infection. The same way, when you are seeing a whole lot of what? Creatinine phosphokinase is a sign that there's muscular degeneration or muscular dystrophy happening, or something is being destroyed, or the muscles are being what? Destroyed. Okay, so these substances what? Are produced. They are what? They are produced, and they're normally found in the heart, the brain, and the skeletal muscles. The heart, the brain, and the skeletal muscles. So in any question, when you see a history of Duchenne's dystrophy or muscular dystrophy or a heart pathology, you must know that there could be the presence of what we call the creatinine phosphokinase. This is not creatine, it's creatinine phosphokinase. This is E, not G, it's E, creatinine phosphokinase. So your answer here should be what? Should be B. Should be B. Upon we have done all these things. We have done them in the booklet. I mean, in the basis. But I'm still taking my time to go through it for most of us. A laboratory experiment on a dog was used to study the central part of auditory system. Again, we have talked about auditory system. One of the mesencephalon structures was destroyed. The dog has lost the orientating responds to auditory signals. When we say auditory, auditory means what? Hearing. Auditory means what? Hearing. So what structure was destroyed? What structure was destroyed? Now, inside the brain, to be specific, around the midbrain area, there is a structure called corpora quadrigemina. Corpora quadrigemina. Corpora quadrigemina, or the quadrigeminal bodies. Quadrigeminal bodies. I repeat, corpora quadrigemina, or the quadrigeminal bodies. These are found inside the brain. And they are made up of two things. Now, this is what I mean. They are made up of two things. Okay, let me draw it for you here. Today, they are going to do a lot of teaching. Okay. Good. So this is your what? Your quadrigeminal body. The whole of this is your quadrigeminal body. And they're divided into what? Into two things known as calculi. We call them what? Calculi. Calculi. Or colliculi. There. The right word is colliculi. Yeah. Colliculi. So it has four colliculi. So we have 1, 2, 3, 4. 1, 2, 3, and then 4. These are called what? The colliculi. So we have four colliculi. We have 2 to be what? Superior, and then 2 to be what? Inferior. Okay. 2 are inferior, 2 are what? Are superior. Now, the inferior ones are for hearing. So these colliculi are for hearing. They are for what? Hearing. And the 2 superior are for what? For vision. These are for vision. They are for what? For vision. So in a question, when they tell you that there's a problem with auditory signals or with vision signals, you should know what they are talking about. So if it's vision, what comes to your mind? The superior colliculi. If it is hearing, what comes to your mind? The inferior colliculi. So, by virtue of what I've described, and yet over here they are saying what? We are having what? An auditory what? Signal problems. Auditory signal problems. So what structure are you talking about or are you thinking of? Of course, you are thinking of what? Of inferior colliculi of the quadrigeminal body, or the corpora quadrigemina. The corpora quadrigemina. As simple as ABCD. So please don't get confused with a question like this. Never. A patient has a decreased concentration of magnesium ions that are required for ribosomes connection to granular endoplasmic reticulum. Now you ask yourself, why would that be? Have you heard of rough endoplasmic reticulum and a smooth endoplasmic reticulum before? I believe so. Now, when we talk about smooth, it means there are no ribosomes attached to them. When we say rough, we are referring to endoplasmic reticulum that have ribosomes attached to them. But the question is, what is the purpose of ribosomes being attached to them? The purpose of the ribosomes being attached to these things, they are for what we call translation. They are for what? Translation. Translation. Don't forget, we have transcription and we have what? We have replication, we have transcription, and then we have what? Translation. Translation. Now, when we talk about transcription, transcription occurs in the nucleus. This is getting interesting. So, assuming you have a cell, so this is your cell, okay? Now, we have your nucleus inside. Then this here is your what? Your cytoplasm, isn't it? Now, transcription takes place in the nucleus, whilst translation takes place inside the cytoplasm. Two different things. Inside the cytoplasm. So the question now is, where can you find endoplasmic reticulum? You and I know that endoplasmic reticulum are located in the cytoplasm, not in the nucleus. It is located in the cytoplasm. Okay, so when substances are preventing the binding of the ribosomes to the endoplasmic reticulum, what it means is that transcription will be what? Impaired. translation will be what? Impaired. And that's why over here, your answer should be what? Translation. Translation. Again, why? We're talking about magnesium ions that are disrupting the connection of ribosomes to endoplasmic reticulum. And we said endoplasmic reticulum is located in the cytoplasm, right? Exactly. And then we are saying, since it is located in the cytoplasm, and they are asking us, and the question is asking us, this condition is known to disrupt the process of protein biosynthesis. So what protein stage will be disrupted? And your answer is what? Translation. Don't go and say transcription, because transcription takes place inside the nucleus. All right. So answer is E. A 6-year-old child with a suspected active tuberculosis process has undergone diagnostic Mantox test. What immunobiological preparation was injected? Injected. What about tuberculosis? So tuberculosis, you are talking of what? Tuberculin. 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 Isn't it? Tuberculin. As simple as that. Tuberculosis, you're talking about tuberculin. So that is what you're looking. I mean, that is what was injected. So your answer here is A. Your answer here is A. All right. During a post-embryonal hematopoiesis, that means production of blood. Good. Production of blood. So during post-embryonal hematopoiesis, that means after the embryo stage, there's what? There is development of what? Cells in the red bone marrow of the cells of one of the cellular difference demonstrate a gradual decrease in cytoplasmic basophilia as well as an increase in oxyphilia. The nucleus is being forced out. Such morphological changes are typical for the following hematopoiesis. Sorry. For the following what? Hematopoiesis. What it means is that which one of them are they actually what? Referring to, or which one of them is going to be affected the most? Or what is happening in this case? So now over here, we are going to be, of course, before I go into the answer, you must know that the red bone marrow is the place whereby cells grow. Okay, that's where we have the stem cells that begin to differentiate and develop into what? Into the red blood cells, into the neutrophils, into the lymphocytes, and so on and so forth. And so on and so forth. Isn't it? That is what is happening. Now, look at it. They are saying that the nucleus is being forced out of the cell. Now, you ask yourself, with all the types of cells, or let me say types of blood cells, don't forget we have to call blood cells, and then we have to call the red blood cells, the red blood cells, the white blood cells. Don't get confused when I say blood cells. Blood cells comprises of what? Everything together. Okay. Now, the question you need to ask yourself is, this is the clue. The clue here is what? The nucleus is being forced out of the cell. So you ask yourself, which one of the cells or the blood cells doesn't have a nucleus? Which cell doesn't have a nucleus? And your answer is what? Red blood cells. Red blood cells do not have what? Nucleus. And that's what they're saying, that eventually there was a decrease in the production, isn't it? Or there was a problem with it. Why? Because the nucleus is being forced out of the cell. So what it means is that what type of red blood and what type of blood cell are they trying to produce in this case? And of course, your answer is what? Red blood cells. Red blood cells, also known as what? Erythropoiesis. Erythropoiesis or erythropoiesis. So here, your answer here is what? Is A. The rest have a nucleus. The rest have a nucleus. Great. The rest are having what? A nucleus. Okay. Now, when taking exams, students often have dry mouth. I think this one everybody can relate to it. Why would you think you're having a dry mouth? Because of the tension, the anxiety present. So you are so what? Conscious of whatever you are trying to do. So conscious, isn't it? So the mechanism that caused this state results from which of the following reflexes? So now ask yourself, if you are going to write an exams, is it a planned thing or it isn't a planned thing? You have exams. Of course, it is planned. And hence, we term it as what? As a conditioned reflex. Something that is planned is called what? Condition. Okay, it's called a condition. Now, assuming a lion, all of a sudden, okay, also you see a snake appearing, you have to condition your mind to run. And trust me, you will run even more than the fastest animal. Believe me. And all of these are called what? Conditioned. Conditioned. And when you condition means it is something that was you train yourself to do or you have planned to do it. So in exams, you read, you prepare for the exams. However, you are still what? Anxious. Now, the fact that you're having a dry mouth is a sign of what? A sympathetic reflex. It's a sign of a sympathetic reflex. It's a sign of a sympathetic what? Reflex. As simple as what? ABCD. As simple as what? ABCD. Okay. Now, unconditioned means you did not plan it. It just happened. Okay. But this one, you have planned it. So here, we're looking at a conditioned sympathetic reflex. Conditioned sympathetic reflex. So your answer here is A. A 67-year-old patient with a clinical diagnosis of chronic bronchitis. Chronic bronchitis. That means a problem with what? With the bronchioles. It's been inflamed and it has been chronic. There's pneumosclerosis. Pneumosclerosis means what? Scarring. Scarring of the lungs. It is scarring. And a cardiopulmonary what? Decompensation has the biopsy of material taken from the suspicious area in his right bronchus mucosa. Good. So now this person has developed bronchitis, there's pneumosclerosis, and there's what? Decompensation what state. When we say decompensation, it means now the body is no longer to compensate for the inability of the lungs to undergo what? Respiration or to exchange gases. Okay. That's what it means by decompensation. Inability to compensate. Great. And now, as a result, now we are taking what? A biopsy. Now, a biopsy is used to check for any sort of what? A neoplastic condition or any sort of cancer problem. So we do what? A biopsy. Okay. So now we are going to analyze why the person is having this kind of stuff. So a biopsy was what was taken from the suspected what area. Now look at the finding. Cellular and cell atypism. When we say atypism, that means atypical cells. It means what? Atypical cells. When we say atypical cells, it means let me say neoplastic cells. Neoplastic cells. That means the cells are growing too much. Proliferation is too much. Okay, that's what? Atypical cells. Okay. Now the thing with early bodies that can be historically detected, what pathological process can be described over here? So definitely you are looking for a case of what? Of a cancer, isn't it? So this is a cancer of the bronchus. A cancer of the bronchus. Because like I said, uncontrolled proliferation is what? It's a cancer or it's a neoplastic condition. Okay, so over here we are looking at what? At a squamous cell carcinoma of the bronchus. Squamous cell carcinoma of the bronchus. So this will be more what? Ideal. Now, when we say metaplasia, it means a tissue has changed from, let's say, from a columnar epithelial tissue to squamous tissue. Okay. And this is very, very common with the people who smoke, whereby their cells will change from columnar tissues to squamous or to something else. That's what metaplasia. But this is a cancer. This is a cancer. So hence your answer is D. Your answer is D. A microspecimen of the heart shows a rectangular cells from 15 to 120 micrometers large with a central position of nucleus. A central position of nucleus. And a developed myofibrils. Myofibrils. You talk about myofibrils. It talks about what? Muscle cells, isn't it? Muscles. So the thing that are inside the muscle that helps you to contract, they're called the myofibrils. So the word myo means muscles. So please put that at the back of your mind. Now the cells are connected by intercalated disc. Intercalated what? Disc. And intercalated discs are very, very common in what? In cardiomyocyte. They are very common in cardiomyocyte. Very common in cardiomyocyte. Now, these cells are responsible for the following function. Of course, first of all, definitely we know it's muscles, and now we know that intercalated disc has to deal with what? With the heart. So this deals with heart contraction. So this has to do with functions of the heart contraction. Functions of the heart contraction. So that is the cell. Functions. So we're talking about cardiomyocyte or myocardial cells. Myocardial cells. So the answer is C. Untrained people often have muscle pain after sprints as a result of lactate accumulation. This can be caused by identification of the following biochemical processes. In other words, when you run, you can have muscle pain around your calf. In fact, those people who train, I think you can relate. If you go to the gym, for instance, after a day or two, you realize that your muscles are weak, painful. If you touch it, kai. You know why? Because there's accumulation of what? Of lactate acid inside that place. And why is there accumulation of lactate acid? This is because you know that glucose is needed for energy production. We discuss it when we talk about the glycogen storage diseases. We discuss in the first question. So please, don't get confused. Now, glucose is needed for energy production. But again, glucose needs oxygen before that can happen, or before it can give you a successful energy or ATPs. Now, you can bear with me that when you begin to run, see how you pant. You know why? Because you are lacking oxygen. You are lacking oxygen. So you need oxygen so that your body can utilize the glucose to produce energy for you. And that's why you get tired easily, because your body is not conditioned in that way. Okay. And because there's lack of oxygen, we call it what? Anaerobic. So we're having an anaerobic respiration taking place. But it's supposed to be what? Aerobic. Aerobic means the presence of air during what? Energy production. And the process of energy production is called glycolysis or glycolysis. Yeah. Glycolysis or glycolysis. In fact, glycolysis. Let me put that way. Glycolysis. That's the process of producing energy in the presence of oxygen. Now, in the absence of that, then the lactate pathway will begin to take place, and hence it produces lactic acid inside your muscle tissues, causing the pain. So, which of the following is causing that or is being impaired? And your answer here should be what? Should be glycolysis. 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 So your answer here should be D. Glycolysis. That is the cause. That is the cause. All right. Now, poisoning caused by botulism toxin. That's botulism. That prevents calcium ions. You know, calcium ions are involved in contraction, right? Good. They are always involved in what? In contraction as well. Cardiac ions. So the botulism prevents calcium ions from entering the axon nerve endings, okay, of the motor neurons in a life-threatening from entering axon nerve endings of motor neurons. It's life-threatening because it is life-threatening because it can lead to what? It can lead to what? So now, like I said, calcium are involved in what? In contractions and things like that, blah, 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 blah. Now, assuming now that your calcium levels are not entering, what it means is that there can be what we call a respiratory arrest. There can be a respiratory arrest. Respiratory arrest. Please take note, respiratory arrest. Because now, due to the absence of the calcium, it is preventing what we call acetylcholine from functioning properly. And when acetylcholine is not functioning properly, what can happen is is paralysis of the respiratory and the skeletal muscles. Okay, paralysis of the respiratory and the skeletal muscles. You and I know that if you want to inspire, there's a whole lot of things that goes on in your body. The intercostal muscles, the external intercostal muscles, the internal intercostal muscles, the diaphragm, all of those things come to play, isn't it? So imagine now there's no calcium, there's no acetylcholine at the neuromuscular junction. What happens? Respiratory arrest. And hence, your answer is B. Respiratory arrest. Now, increased HDL levels. HDL levels. That is what? High density lipoprotein or lipoprotein. High density. Have we heard of a good cholesterol and a bad cholesterol before? If you don't know, it's take it from me. We have what we call a good cholesterol and we have what we call a bad cholesterol. Now, one of the causes of atherosclerosis is because of increased amount of what? Bad cholesterol. Bad cholesterol. And that is called what? LDH. That is low density lipoprotein. LDH. LDH. And what LDH does is that it carries cholesterol to the cells. It carries cholesterol to the cells, to be specific, to the vessels. And when these substances are found in the vessels, reaction begins to take place, or inflammatory reaction begins to take place because it is not needed inside the cell or inside the vessel. It is not needed, but now it is there. So LDH carries cholesterol to the cells, whilst HDL, that's the LDH. LDL, please. LDL, not LDH. LDL. Now, HDL carries cholesterol from the cell to the liver. Okay, it carries cholesterol from the cell to the liver so that the body itself, the liver itself can detoxify or can get rid of it. Okay, great. That is what we have. So this one is called what? Bad cholesterol, whilst the HDL is called what? It's called the good cholesterol. So now the question now is, HDL decrease the risk of atherosclerosis, of course. Now, what is the mechanism of it? By virtue of my explanation, what it does is that it will remove what cholesterol from the cells or from the tissues to the liver. So here, your answer is what? Is E. Is E. Is E. Now, they supply tissues with cholesterol. That is the function of what? LDL. So in Krok, if they don't bring this and they bring that, of course, you are well informed. It has been found out that one of the pesticide component of sodium arsenate, one of the component is sodium arsenate that blocks lipoic acid, which enzyme activity is impaired by this pesticide, which enzyme is impaired by this what? Pesticide. Now you must know that arsenate or sodium arsenate, they block lipoic acid like it has been indicated. And this lipoic acid is a cofactor of what we call E2. It's a cofactor of what we call E2. And this E2 forms part of a complex enzyme called pyruvate dehydrogenase complex. I repeat, this lipoic acid is a cofactor. When we say cofactor, it's like an activator of this enzyme, E2. And this enzyme, E2, forms part of this broad or complex what? Enzyme called pyruvate dehydrogenase complex. Pyruvate dehydrogenase complex. And for the purpose of learning, this pyruvate dehydrogenase complex comprises of 3 enzymes. One is the E1. And this E1, so we have E1. This E1 is a cofactor for TPP. If you heard of it before, that is the thymine pyrophosphate. Thymine pyrophosphate, that's the E1. Okay. Then we have the E2. The E2, like I've already told you, it forms part of what? The E2 has to deal with coenzyme A. Coenzyme A. Coenzyme A. Then we have what? The E3. This is a cofactor for NAD and an FAD. Please let me not bore you with all this biochemistry stuff. But I just want you to understand that this lipoic acid forms part of an enzyme what? Complex. I mean, it's a cofactor for an enzyme which forms part of this enzyme what? Complex. So over here, your answer is what? Is A. This is biochemistry, and biochemistry is lovely. If you have the time, we can go into it. Now, a dry cleaners worker has been found to have hepatic steatosis. Hepatic steatosis, meaning there is what? Fatty liver. Hepatic means liver. Steatosis means what? Fatty or too much of what? Too much of what? Fatty acid. Then put it that way. Or too much of fat. That's the right word. Too much of fat. So steatosis simply means what? Fatty liver. Fatty liver. And one of the things that you must understand is that choline controls the concentration of phospholipids in the liver. And you know this phospholipid, in a way, form part of the structure of every cell. Phospholipids, isn't it? They form part of every cell or every cell membrane. You can go and check it out. Phospholipids are forming part of cell membranes. So when that place is impaired, what happens? It means that the substances that are there will begin to be released. To begin to be released. And again, what will make that to be released is because there is a problem with the enzyme that helps to concentrate these phospholipids. Phospholipids are fat, okay? So the enzyme that helps it is called the choline. The choline. So over here, the absence of choline, and for that matter, phosphatidylcholine, is the result why we are having too much of what? Of fatty liver or hepatic steatosis. Hepatic steatosis. So over here, we are looking at what? At C, phosphatidylcholine. Phosphatidylcholine. So your answer here is C. A 35-year-old man with a peptic ulcer disease has undergone antrectomy. That means the antrum part of the stomach has been removed. Now, after the surgery, secretion of the following gastrointestinal hormones will be distracted. So the question now is that when you remove part of the antrum, or when you remove the antrum, which is the lower third of the stomach, what happens? You are literally removing the part that is responsible for the production of what we call gastrin. So the parietal cells will be wrapped off, will be taken away. And these parietal cells are responsible for the production of what? Of gastric cells. Gastrin, or gastric juice, as many of you would like to call it. So that place will be affected. That's what over here, your answer is what? Gastrin. All right. Atretic bodies and developed yellow body that can be observed along the follicles of various orders in an ovary specimen. Okay, what stage of ovarian and menstrual cycle is characterized by the described ovary condition? Ovary condition. Now, you know that there are 4 phases of menstrual cycle. There are 4 phases. Ladies will know it better. We have what we call the menstruation, or you know of the menstruation. You know of what? The follicular phase. You know of what? The ovulation stage, and you know of what? The luteal stage. Some books will say we have 3. That is talking about what? The follicular phase, the ovulation, and the luteal phase, which most of you know about. Most of you know about. Now, they are saying that there is a problem. A yellow body can be observed along the follicles. Along what? The follicles. Now, you must also understand what a follicular atresia is. A follicular atresia is. And the follicular atresia is simply the breakdown of the ovarian follicles. Ovarian follicles. Follicles. Ovarian follicles. So if those areas are having problems, what happens? What happens? It means that this person is getting prepared to be what? To undergo what? Menstruation. You are getting prepared to undergo what? Menstruation. In other words, now, yellow body simply means what? Corpus luteum. Corpus what? Luteum. And that is the last active stage of an ovarian what? Follicle's life cycle. And these are observed before menstruation. Okay? It is observed before menstruation. Someone's microphone is on. Dr. Tolu, kindly mute the microphone for me. Thank you. All right. So like I said, these corpus luteum are observed before menstruation. And that is why over here, we are going in for what? For a premenstrual stage. Premenstrual stage. Premenstrual stage. I don't want to go through too much of this thing, but basically, we're looking at what? A premenstrual stage. So your answer here is A. Is A. Is A. Is A. Okay. Now, I explained the follicular atresia because this is what is happening. Actually, this is what is happening. Atretic bodies and follicles. So we're having the follicular atresia. So please don't get confused. So the answer is A. A 16-year-old adolescent is diagnosed with hereditary UDP, that's uridine diphosphate, glucuronidase transferase deficiency. Guys, all of you know about this whole thing. Lab test revealed hyper. Now, say hyper bilirubin. What does it mean? It means too much of what bilirubin are observed, and at what condition or under what condition? No, who's calling me at this time? So the question now is that under what condition are we going to have increased level of what? Of this sort of what? Bilirubin. Under what level? Of course, one there's breakdown of what? red blood cells. And that's what's happening in this patient. There's a breakdown of what red blood cells. And don't forget, we have 3 types of what we call, let me say, jaundice. Because eventually this person is going to develop what? Jaundice. In fact, this is jaundice. This is what? Jaundice. Okay. Now we have 3 types. We have what? The pre-hepatic. We have the hepatic. Then we have the post-hepatic or the obstructive type of what? Jaundice. Now in pre-hepatic, that means before the liver, mostly it is because of what? Hemolysis or breakdown of what? Red blood cells due to some enzyme deficiencies or due to harsh conditions or due to a too much oxidative reaction on the cells. So they begin to break down and they release a lot of unconjugated bilirubin. Now, conjugation takes place inside the liver. Conjugation takes place inside the liver. So when the cells do not pass through the liver, it means conjugation will not take place. And if conjugation doesn't take place, it means that a lot of the bilirubin are more of what? Unconjugated. In other words, they are not conjugated. Okay? In some books, they will say indirect bilirubin. Indirect bilirubin. So please take note. Indirect or unconjugated, they are normally present in hemolytic diseases. Good. So over here, we are looking at what? At unconjugated. Because the question is, the lab reveals this, but what is the most, this is caused mostly by the increased blood content of the following substance. That means which one of them, of course, we know there's too much bilirubin, but which type of bilirubin? Unconjugated. Unconjugated. Now, prior to glucose utilization in cells, again, glucose utilization means to be taken up by the cells, isn't it? Now, prior to glucose utilization in the cells, it is transported inside cells from the extracellular space through the plasmatic membrane. This process is stimulated by the following enzyme. In other words, when there is too much of sugar in the cells, what takes sugar from the cells into the tissues? Now, when I say cell, I'm talking about the blood cell. See, this is a blood cell, okay? These are tissues here. There are tissues over here. So inside here, we have glucose. We have a glucose. So what takes glucose? Now, don't forget that if there's too much glucose in this vessel, we call it what? Diabetes. We call it diabetes. So what enzyme or hormone is needed in this place to take away the glucose from the vessel into the tissues? And your answer is what? Insulin. And the only way that is that it makes the cell membranes of the tissues permeable, or it has some special what? Transporters. We call it the GLUT1. Some of you might not know it, but that's called the GLUT1, GLUT2, and 3, blah, 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 blah. But don't worry, there is not your level to know. But if you know it, it's always good. But we have the GLUT1. These are glucose transporters. And they are activated when, when insulin comes to play. So if you have too much of glucose, please, you give the insulin, they will disappear into the tissues. So the answer is A. After implantation of cardiac valve, a young man systemically takes indirect anticoagulant. Now, when we say anticoagulant, that means something to prevent what? Coagulation. Something to prevent what? Coagulation. That means bleeding might ensue, isn't it? Now, his state, you see, his state was complicated by hemorrhage. Now, what substance content has decreased in the blood? What substance has decreased inside the blood? Again, anticoagulant prevent coagulation. And of course, if you prevent coagulation, it means you can develop what? Hemorrhage. You can develop what? Hemorrhage. But then again, now, numerous hemorrhages during blood coagulation test, okay? If you do a test, it normally reveals an increased prothrombin time and increase prothrombin time. Prothrombin time. So over here, we're going to look at what content will be what decrease. Now don't forget prothrombin time is different from what prothrombin. Okay, so that means that when there is a decreased prothrombin, it means that the prothrombin time will be what increased. Good. Will be what increased. So over here, what substance is decreased in the blood? Of course, prothrombin. And when prothrombin is decreased, it means that the prothrombin time will be what? Will be increased because you need more prothrombin before it can work. Now we'll talk about so let me just give you as an assignment. Go and look for the function of what? Prothrombin. Look for the function of prothrombin. This is an assignment for all of us. Look for the function of what? Prothrombin. All right. A 12-year-old patient has white no pigmented spot on the skin. What do they even mean? They have white pigmented spot. There's nothing like this thing. They have white pigmented. It's a non-pigmented. A 12-year-old patient has white non-pigmented spot on the skin. The spots appear after the patient became 10 years old and they constantly grow. The spots appear due to lack of the following skin cells. Lack of the following skin cells. Ladies and gentlemen, what is involved in pigmentation? Definitely is what? It's the melanocyte. The melanocyte. They are responsible for all this kind of skin pigmentation thing. So please don't confuse yourself. Your answer is what? Is melanocytes. So D should be your answer. A group of Ukrainian tourists returning from Samarkand was bringing with them Goebbels. During examination in custom of office, ulcers were detected on the skin of the animals. There were ulcer formation on the skin of the animals. Okay. What protozoa is the most likely to cause the disease in the animals if mosquitoes are the carriers? Now, if you say mosquitoes are the carriers, you know that because of the carriers, what disease normally comes to your mind is what? Is malaria. But this is not a case of malaria. So don't go and choose Plasmodium falciparum. No. Don't go and choose Plasmodium falciparum, because that one is the causative agent for malaria. But this is not talking about malaria. This is not talking about what? Malaria. Please no. So we can rule out what? The Plasmodium falciparum. But basically, this question is talking about what? Leishmania major. Leishmania major. Leishmania major. As simple as that. Leishmania major. So over here, your answer should be what? Leishmania. Don't forget, in Toxo, you're basically dealing with what? With cats. You are dealing with what? With cats. With cats. So please don't forget, you're dealing with cats. With cats. All right. And over here, they normally usually present with lesions at the site. And usually they are caused also by what we call the sunfly bite. I don't know if you heard of it before. Sunfly bite. So please take note of some of these little things that might get you confused in your exam. So this, you are talking about Leishmania. A 5-year-old child has been diagnosed with acute right distal pneumonia. Now, pneumonia simply means inflammation of the parenchyma of the lungs. Now, they say sputum inoculation revealed that the positive agent is resistant to penicillin and sensitive to microlides. The question now is, what drugs should we prescribe? Now, if they say penicillin is not working, that means it's resistant. So your duty now is to look out for what is sensitive. So microlides. So the question now is, What type of macrolides do you know? So that's the question. So the macrolide here that you can be thinking about is what? Is azithromycin. So we have erythromycin and azithromycin. These are the two major ones. So we can talk about erythromycin or erythromycin. We can have azithromycin, clarithromycin. All of these are all what? Macrolides. Macrolide. We have done this in pharmacology already. So let me know which much time on it. So your answer here is what? Azithromycin. To an emergency ward, a 7-year-old child was delivered in the condition of allergic shock caused by a bee sting. High concentration of histamine is observed in the blood. Production of this amide is the result of the following what? Reaction. That means under what condition do we have degranulation of mast cell? Because of course, this histamine is coming out from what? From the mast cell, isn't it? From the mast cell, because they are the eosinophils and mast cell. They are the cells responsible for the release of this kind of what substances that comes to harm our tissues. So you're talking about what? Degranulation of the mast cell. And if you're talking about degranulation of the mast cell, definitely you are looking for what? Decarboxylation. Because decarboxylation will make the histamine very active and it begins to cause what? A lot of what? Trouble, leading to vasodilation and bronchoconstriction. Vasodilation and bronchoconstriction. And the process that they use is called what? It's called decarboxylation. 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 All right. So the answer here is what? Is decarboxylation. All right. A 65-year-old man is suffering from gout. When we say gout, that means there's too much of what? Uric acid in the tissue. Okay? Too much of what? Uric acid. And usually the best place it occurs is on your big toe. Your big toe. It normally likes that place a lot. All right. But let's look at the question. Now there's pains in his kidneys. Okay? Ultrasonographic examination revealed kidney stones. A certain substance in the increased concentration can cause kidney stones formation. Name this substance. Of course, like I said, what substance are we looking at for over here? We are looking at for what? Uric acid. And uric acid can also cause what? Kidney stones. It can also cause what? Kidney stones. Apart from calcium, it can also cause what? Kidney stones. So please, over here, we are looking at what? At uric acid. And again, uric acid is coming from the breakdown of what? Of purine. Purine. We've talked about this, purine. So please do well to go through the videos so you can get more understanding of some of these things. Sex chromatin was detected during examination of a man's buccal epithelium. A man, buccal epithelium. It is characteristic of the following chromosome disease. Chromosome disease. They said sex chromatin was detected. Sex chromatin was detected in a man's. You know, a man should normally have what? XY. A man should always have what? XY. But here the case is another sex chromatin was detected again. So then now we're having what? XXY. And this condition is known as what? Klinefelter. This condition is known as Klinefelter. So here we are looking at what? Klinefelter's what? Syndrome. So a man having an extra X. Okay, a man having an extra X. Having an extra X. Now in trisomy. Now, okay, so now let me explain something about bowel body. Maybe some of you might have heard it before. Let me just go through it for you guys. Now we have to call a bowel body. Get you to know this one better. We have to call a bowel body, and a bowel body is simply an inactive X chromosome or X chromatin. Okay? A bowel body is inactive X chromosome or X chromatin. Now, a normal female has one bowel body. It has one bowel body. So we have what? XX. It has only one inactive. It has one bowel body. And a normal male has no bowel body. I repeat, a normal male, XY, you have no bowel body. Okay, so now imagine I give somebody X, X, X. How many bowel body are you talking about? 2. Because at least every human being, you must have what? An active X chromosome. No doubt. So any other X that is present is what? It's a bowel body. I hope that one is explained better. It's a bowel body. So if you have triple X, that means you have 2 bowel bodies. 2 bowel bodies. As simple as that. 2 bowel bodies. Now, if you have XO, which is also another condition in Turner syndrome, we have what? XO or OX, XO. Of course, there's one X, but unfortunately, you also have either another X or another Y to attach to it. So that means this one will be what? 45. The character will be 45 XO. 45 XO. But every human being should have 46. 46, either XX plus either XX or XO. Great. So please, you must know some of these things. So over here, it has no bowel body. No bowel body is here. No bowel body. All right. That was just by the way to add up for you guys. Now, pure culture of microorganisms was obtained from the pharynx of a child with a suspected diphtheria. Suspected diphtheria. Okay. Morphologic, tentorial, cultural, and biochemical properties of microorganisms were studied and revealed to be characteristic of what? Diphtheria what? Agent. Diphtheria what? Agent. What investigation should be additionally performed to make a conclusion that these microorganisms are pathogenic diphtheria bacilli? So the question now is, what is the causative agent for diphtheria? Because if you know the causative agent, of course, you can know what your answer is. And of course, the causative agent is what we call Corynebacterium diphtheria. Corynebacterium diphtheria. And they normally infect the nasopharynx or the skin. And normally, they have toxigenic strains. So that means they have toxic activity. So toxigenic strains. And so therefore, over here, your answer is what? Is to determine the toxigenic properties. Again, if you know the disease, you have no problem. So if you know the causative agent, you have no problem. Now, the autopsy of a man who had tuberculosis revealed 3 by 2 centimeters large cavity in the superior lobe of the right lung. So that means they've given you something 3 by 2. So it's like something focal is there. Or something is there, isn't it? By the size is what? 3 by 2. Cavity is a cavity, 3 by 2. Now, the cavity was interconnected with the bronchus. Its wall was dense and consistent of 3 layers. The internal layer was pyogenic, that means pus infection is there. The middle layer was made of tuberculous granulation tissue, and the external one was made of what? Connective tissue. So what is the most likely diagnosis? Now again, anytime they're talking about cavity in the lungs, please, we are thinking of what to call the word cavity also means what? Cavern. So cavern. Okay, cavern. Good. Now, so obviously we have what? A cavernous reaction or a cavernous tuberculosis. Right? We've got cavernous what? Tuberculosis because of the presence of what? Cavity inside the superior what? Lobe. If they have said the presence of a node 3 by 2, then you are talking something more focal. There's not something more focal. Isn't it? But over here, they said the person having what? A cavity present. And again, the internal layer is what? Pyogenic. pyogenic. And look at the external layer. Connective tissue. That means fibrous. Fibrous tissue. Fibrous tissue. Connective tissue are made up of what? Fibrous tissue. Isn't it? So over here, your answer should be what? Should be a fibrous cavernous tuberculosis. Fibrous cavernous tuberculosis. I think I've discussed some of these things in one of our presentations. So please, again, do well to look them up. Check them up. Okay, check them up. A 7-year-old child has acute onset of disease. Temperature rise 38 degrees. There's rhinitis, there's cough, there's lacrimation, and a large spot rash on the skin. Pharyngeal mucosa is edematous, hyperemic, with whitish spot on the buccal area. What kind of inflammation causes the changes in the buccal mucosa? Even somebody who have not really don't know much, they do that, oh, my son has a catarrh, or my child has a catarrh. Because there's rhinitis, there's coughing, there's lacrimation, and all kind of things. So, oh, there's catarrh, isn't it? As simple as that. So you are not far from what? From right. So this person is having a catarrhal type of what? Inflammation. Now, don't forget, in fibrinous type of inflammation, we're having what? A whitish thing. I mean, a whitish sort of what? Fluid, or a whitish inflammation. Okay. Don't go and say because there's a whitish spot, it's the same as a whitish inflammation. No. Totally different. Now, under fibrinous inflammation, we have what we call Krupus. And then we have the called diphtheric, if you have heard it before. Yeah, I can see some of you are nodding your head. We have a diphtheric. Now, in Krupus, it is easily what removable, or you can easily scrape it off. Now, with diphtheric form of fibrinous inflammation, if you try to take it off, it will bleed. So they will tell you that in a question. And I'm saying this because we have met a lot of questions like that in our previous presentation. So please take note of these sort of what things. So here we're having what catarrh. Why? Because we're having what rhinitis, we're having cough, we're having what lacrimation, the mucous membrane, all of them are having problems. So this we can term it as what? As a as a catarrh sort of what? Inflammation. Catarrh sort of what? Inflammation. So your answer here should be what? D. Now, in suppurative, you are basically talking about something more of what? A pus formation. A pus formation. Some of you say a pus formation. So a pus. P-U-S. A pus formation. A pus formation. Okay. Or a pyogenic sort of infection. Okay. That's what gives us what? A suppurative. Then talk about hemorrhagic. The name hemorrhagic tell you there will be blood. Now, with a serous type of inflammation, it means the exudate is just the same as the tissue itself, or the exudate is, the exudate is clear. Let me put it that way. The exudate is quite what? Clear. All right. So here answer is what is D, catarrh. Analysis of sputum taken from a patient with a suspected pneumonia. Again, a question on pneumonia revealed a slightly elongated, gram-positive diplococci with a pointed opposite end. What microorganisms were revealed? So over here, you are looking at what? At streptococcal pneumonia. Streptococcal pneumonia. Streptococcal what? Don't forget, this one is causing what? Pneumonia. It's causing what? Pneumonia. So this is what? Streptococcal pneumonia. Streptococcal pneumonia. So don't go and say this necessarily gonorrhea, because you might be confused with the diplococci. Don't confuse with it. Please. Don't get confused with it. Don't forget, they'll tell you it's like a bean shape. A bean shape. All right. So over here, your answer should be what? Should be D. And of course, this is typical type of what? Pneumonia. Not every. Most pneumonias are caused by streptococcal pneumonia. All right. So your answer is D.